Hey everyone, it's Anastasia, Anastasia's Hump Day Happenings. Today I'm going to share with you 10 things to look for, oral side effects, if you are going through cancer therapy, what you need to ask your dental hygienist if they don't ask you, what your dental hygienist should be sharing with you, and why we should connect with the oncologist, because it matters. Your oral health it's your health. All right, number one, dry mouth. Dry mouth is going to be a given. It's important to share with you the side effects of what dry mouth or xerostomia can do. I'd say start with the basics and making a health and wellness visit with your dental hygienist and going through and connecting with your oncologist. What I mean by that is to say, what is my risk for tooth decay? What is my risk for gum disease? What is my current state of oral health? And tell me what I need to look for tissue changes and when my mouth is dry. Why do I say that? If you're more at a high risk, moderate or high risk for tooth decay, and you have dry mouth, more bacteria is going to collect, not a good thing. That means amped up for tooth decay. The same, it can cause more problems for gingivitis, which then leads to bone destruction and periodontal disease. Number two, mouth sores or oral mucositis. I'm going to give you a statistic. 40% of individuals going through chemotherapy, battling and kicking cancer's butt, will get mouth sores or oral mucositis. It'll start 5 to 10 days when you begin treatment, and it won't end until 1 to 6 weeks after treatment. It's red and it's got a little white halo. It looks like a little ulcer. There's nothing angelic about these because they can cause you to stop eating, and you've got to feed your body with nutrients and vitamins, minerals to stay strong. So how do you fight this? Most people will use it through a mouth rinse. 2 mouth rinses that are usually given. Number one, an alcohol-free chlorhexidine. It is antibacterial. You can only stay on it for like 8 to 10 days, give or take. And then the second one is CPC related, which is a broad spectrum antiseptic. We'll get into mouth rinses in a few moments, but oral mucositis is something to definitely consider. This can really cause a lot of problems for a lot of people. Number 3, toothbrush. Soft bristle, I'm talking extra soft if you can find it. Ask again your dental professional. The average number of soft toothbrush bristles in a toothbrush are 2,500. One of my favorite manual toothbrushes is made by Curaprox. They have 5,460 soft bristle toothbrushes. This is when I would say, if you're going through chemotherapy and radiation, to use this. Toothpaste. Avoid whitening products. Avoid things with peroxide in it. Some people, not all people, some people will be sensitive to sodium lauryl sulfate. Know this and just ask ahead of time. It goes back to your current state of oral health. There are some people that can still use a toothpaste, which is amazing. That's awesome. And you may have to do that if you're at a high risk for tooth decay. You may have to have a prescription toothpaste with a higher amount of fluoride that may have sodium lauryl sulfate in it, and you may not be affected. That's awesome. But we need to connect so it's a customized oral fitness program for you as you are battling breast cancer. Number 5, can't believe I'm going to say this one, but I am. Flossing. You need to get together with your oncologist, because if your blood counts are low, your bleeding to your gums is going to be increased. For most people, who is flossing? Who's flossing properly anyway? I'm not. What I do use, these are mine. The red is for the front of my mouth, and the yellow is for the back, because my spaces vary in between the teeth. So yes, this is for the breast cancer awareness, and then I've got domestic violence awareness right there. So you can use these. You can use soft picks, you can use go-betweens. There are so many amazing in-between interproximal brushes that can help you. The other option that you can have is warm water with the flushing of a water pick. Love it! It's great and it's gentle, and that's what you really need. It's what your gums need. Number 6, mouth rinses. Okay, 0 alcohol. You do not need alcohol and you don't need peroxide. A couple other products that I think may be helpful are Closis and OraCare, so you might want to ask about that. Number 7, lips. A lot of people like lip balm because you're going to have dry mouth. You protect it. I'd say if you can get sunscreen, that would be awesome, because here in Florida, I mean, that's a given, right? You're gonna be in the sun. Something with beeswax or a vegetable-based lubricant, anything with petroleum is really going to attract more bacteria. You don't need the drama. Number 8, dentures. All right, you may have to take these out when you're undergoing radiation, but you take them out at night. I know it's not glamorous, I know that, but it's really in keeping you healthy. So, your dentures are very porous, so you want to soak them in a warm bath of whatever product that's recommended by your oncologist or your dental hygienist overnight. Now you also want to check, what do the tissues, what do the ridges look like? How are they healthy? Are there sores on them? Are your dentures fitting properly? Know this, if you lose weight, you may have to have them relined, and depending upon how old they are, you may have to have a new set too by the time that you go through all of this. So when you lose weight, they may fit looser, but we want to make sure the tissue underneath there is very healthy, and we also want to make sure your denture is fitting properly for you to eat and feed your body. Number 9, prior to your health and wellness visits with your hygienist and your dentist, ask your oncologist. You may have to take an antibiotic, because if you have a port for chemotherapy delivery, again, it's all in prevention and being proactive and empowering you. And then finally, your hygienist should always take your blood pressure before your health and wellness visit. They should ask you, what side did you have lymph nodes taken out of? Because we are not going to take a blood pressure reading. If it was on this side, you don't take a blood pressure reading on the left arm. You would take it on the right. We do not need to inspire any bout of lymphedema, okay? But this is something sometimes that we just don't ask, and we immediately go onto the left arm and we just start to take the blood pressure. So those are 10 things to be aware of that you really need to get and unite your dental professional with your oncologist in effort, because your oral health it's your health, and we want to keep you healthy as you battle this and kick cancerous butt. Now please comment. I'd love to know if this was helpful to you, if it inspired you or empowered you on something you did not know. This should be on your dental practice's social media pages for sure, just so we can ask that. I'll create a PDF. Just go to my website, I'll click the link, and then you can download that too, so you can ask these questions. There's a lot of stuff in these minutes that we had, but I do hope it was very helpful for you. Like this channel, join me every single week, and until next Wednesday, take what you learn and make a difference with it.